Hello everyone. So in this session we are going to see PSUR section 7 summaries of significant findings from clinical trials in the reporting period. So in this section just you need to keep in mind that you know only MAH sponsored CTs alone should be presented. MAH sponsored CTs. CTs means traditional interventional clinical trial alone will cover, and the second point is only the reporting period, that is the reporting interval data alone we will focus. Okay, these 2 points are a take home message. Okay, apart from MAH sponsored, if there is something, so there is a separate section for that. So only MAH sponsored and reporting period alone, you should keep it in mind. And this section is being further divided into subsections like section 7.1, what they will focus on completed clinical trials, 7.2 ongoing clinical trials, 7.3 long term follow up, and 7.4 other therapeutic use of medicinal product, and 7.5 which talks about new safety data related to fixed combination products. Okay, so this how this particular section flows. And in 7.1 usually they focus on if you during your review period, okay, if any clinical trials has been completed. Completed clinical trials means when the clinical study reports has been generated. Okay, CSR should have get generated, then only it is considered as uh, completed clinical trial. The last patient, last visit, everything might have done, but the moment the CSR is generated and it got approved, then we will consider them as a completed clinical trial. So during your review period, example, if one trial is being completed, then you need to write a short summary out of it, and you can provide this CSR as a in a separate appendix to read the entire CSR. Could be a synopsis, you can provide in a for as a supporting documents. Same like this for 7.2 ongoing clinical trials. Ongoing clinical trials, just you need to understand, is there any interim safety data has been reviewed and analyzed. If you have come across anything, then so the entire section, the responsible is the clinical research team. The CT clinical team would be responsible, so they will focus on this particular section. And one more thing, you need to keep it in mind that in section 7, whenever anything lack of efficacy, okay, any product, if you have come across the indication of the particular product is for serious indications. Serious indication is usually for any cardiac impairment, or if the medicinal product is not being used, the patient will go into very serious conditions. So that kind of medicinal product, anyways, you can refer in the reference safety information what are all the indications of that particular product, and also you can connect with global medical safety whether it is falling the serious and the life threatening indication, so that can be confirmed. If you have noted any lack of efficacy, then you have to present the analysis under section 13 as well. So that's another portion. But apart from this, not any serious or life threatening conditions, then so those presentations can be presented here. Okay, so here we are talking about completed clinical trial, MH sponsored, and ongoing trials. And section 7.3 is focusing on long term follow up. So here in long term follow up, usually it is for a advanced therapy only, mainly they will be applicable, you can say. Example like any gene therapy, cell therapy, or any tissue engineering products. So for that kind of related products only, the long term follow up is necessary in the clinical trial setup. So that is if you have something, then you can write. Otherwise, usually the company specific, they would be writing not applicable, or there are no long term follow up applicable. something they would be able to write as per their template. And section 7.4 which focus on if MAH is specifically designed any patient support program or any expanded access program, any compassionate use program, or any particular patient use, or any organized data collection if they have initiated that follows a specific protocol. So that analysis can be presented here. And here in section 7.5 new safety data from related to fixed combination product. So here you need to just in order to give you a very simple example, like if you are writing a PSUR, and that contain just amlodipine, and another PSUR what you have in the as you are a MAH amlodipine with hydrochlorothiazide. Okay, SPZ, you have hydrochlorothiazide when you are writing this PSUR. Okay, and just keep it in mind that any new safety data is there for the amlodipine plus hydrochlorothiazide. Anything we are missing out, anything, and anything from there that need to be presented in your PSUR, just keep it in that in a simple language, because the experienced candidate might have gone through many different scenarios, but for this session is only focusing for the new joinees and entry level aggregate reports. Only this entire session is been focused, so just understand in a simple way. And another person, or you also got to write only this PSUR, then you need to think about anything from this particular amlodipine that need to be carry forwarded, or that information something which is not presented in our report that need to be mentioned here or not. So anyways, that need to be checked with your global medical safety as well as clinical team, and that can be linked. So it's a kind of vice versa. If you are writing the same kind of product, then you need to think in either way, stating that if you are writing amlodipine, then you need to think of other your product only, that place anyways amlodipine plus hydrochlorothiazide, that you need to focus. And also sometimes this particular product might have undergone to any investigational clinical trials or something. There might be some other fixed combination also they are trying it out with multiple region, or regimen or something, hydrochlorothiazide along with another calcium channel blocker or something. If they are trying for that, then we need to keep it in mind that you are focusing on any important active ingredient you are writing. There is a parallel something which is going around, you need to think of. And any new safety data, if you have noted something, you can describe about that particular thing. So that's how we can say about in a very light note of section 7. Okay, we can see the other sections in the next class. Thank you.